This is the injury report presented by NYU Langone Health. All right, guys, for today's injury report, we're talking about how long the 49ers should expect their QB1 Brock Purdy to be out after he missed the last game with shoulder soreness. So let's bring in Dr. Michael Alaia, professor of orthopedic surgery over at NYU Langone Health. Doc, man, welcome back. Thanks for hopping on with us.
Appreciate it. How you been?
All's well over here, man. Feeling better than Brock Purdy right now, but I need you to make sense with this one because something's not really adding up, and I'm going to break this down for you. So he had the MRI early last week. That showed no structural damage. He rested Wednesday, then he threw a little during warm-ups on Thursday, but he left practice to go back into the training room because of soreness, and then he got a second MRI. Why a second MRI, Doc, and what exactly were they looking for?
Well, I mean, being that he's a quarterback, this is his dominant arm, this is his profession. I think they want to just make every certainty possible there that there is no major structural damage to the arm. You know, MRIs aren't perfect. Occasionally, MRIs will miss things and go out and continue to play and continue to have pain. So it's not without reason that you go back in for another MRI. We certainly do it for patients here. One MRI might be inconclusive. They continue to have pain despite the appropriate treatment. Getting a little bit more imaging, never, ever a big deal.
All right, well, head coach Kyle Shanahan said on Monday that Purdy threw lighter today to see if the rest helped, and the rest did help him, and that they're going to let him rest all the way up until Wednesday. Today's Tuesday when we're filming this, so what are doctors going to be looking for on Wednesday to possibly clear him again to go back out and start throwing at practice?
Well, I think a lot of it just depends on his ability to play. You know, it sounds that in the context of a normal MRI that he's clearable now, just assuming that his physical examination and his ability to throw is really not compromised. So if he can get out there and throw unencumbered, painless, good range of motion, good velocity, good accuracy and precision, I think they're going to probably let him play. But if he's not able to do that, then obviously he might not have the accuracy that he's looking for or the velocity, so he might have to sit a little bit.
What would you say?
This is more about symptoms than anything else.
So what's more important for him right now, the rest or the rehab?
I think it's a combination of both. You know, the first step in any injury is to reduce the inflammation. So how do we get the inflammation out? That's by relative rest, modifying your activities, anti-inflammatories, modalities, physical therapy, etc. And then after that happens, then you work on strengthening. You start with a sport-specific return to play, check the velocity, check the accuracy, and if he can meet all of those standards and expectations, then he's going to be able to get out there and compete.
All right, well, they got a big one on Sunday. They're 5-6 right now. They play the Bills out in Buffalo. Big game with huge playoff implications. Is it worth taking the risk to play him and put him out there if he isn't 100%?
Well, you know, I think the beauty of two normal MRIs tells you that the shoulder is pretty good. So the only thing that's limiting his ability to play might be just because he's having pain or inflammation. So I think within reason, if he can go, he can probably go, considering that the MRIs are normal. I don't think he's really going to be risking significant damage because in the setting of a good-looking shoulder anatomically and structurally, I think more of this is just pain than anything else, and it's just soreness.
All right, so it's more pain management than anything else. But they'll say you're clear. You're not going to mess it up. Even worse, it's just you just got to bear through the pain throughout the course of an NFL game, and we know how hard that is. So let's say you're an everyday person, not an NFL athlete, that is experiencing kind of the same shoulder symptoms and soreness. They don't have the NFL training staff to diagnose and treat them. So what would be their rehab and recovery options?
Yeah, you know, the first thing starts with relative rest. You know, making sure that the inflammation dies down. And as that initial phase of inflammation starts to calm down, then you could start more with a structured program in terms of strengthening. So it's very common that people come in with rotator cuff pathology, biceps tendon pathology in the shoulder. And the first step is to just make them pain-free. And once the pain goes away, then we can work on getting them back to their sport so they can go 100%. But, you know, the treatment for the layperson and the professional athlete tends to be the same for this kind of issue. The only question is how fast is it going to take? And thankfully, the athlete has literally every mode of management possible with their entire training staff from top to bottom. We don't really have that as, you know, your average Joe. But the treatment algorithm and the structure is really the same.
All right. Well, Doc, thanks for coming on and clearing that up for us. All eyes are going to be on Wednesday to see if he can get back out there or practice. But again, thanks for joining us.
My pleasure.